Okay, let's be honest. Does the thought of pediatric med questions on the NCLEX make your palms sweat? Yeah, you are not alone. It is one of the highest stakes topics you're going to face. But what if? What if you could swap that anxiety for a clear, confident strategy? Well, that's exactly what we're going to dive into today. Now, that quote, look, it's not meant to scare you. It's meant to focus you. Because on the NCLEX, and more importantly, in your actual career, a single decimal point, that can literally be the difference between a right answer and a really critical error. So this is so much more than just passing a test, right? This is about building that life-saving muscle memory for safe practice right from day one. So, you know all that rote memorization? Just forget about it. That's not what the NCLEX is about. They're going to throw you a really complex scenario and basically ask, okay, what do you do right now? It is a test of your clinical judgment when you're under pressure. Can you get the math right and adapt to the situation and prioritize what matters most? That's the real skill, and that's what we're going to break down. All right, so where do most people get tripped up? Well, it almost always boils down to just a few common but really critical gaps in their thinking process. And these are the spots where a tiny oversight can have some major consequences. Yep, these are the classic NCLEX tripwires. I mean, of course, you've got the math, right? A misplaced decimal point when you're calculating a dose, super common. But honestly, it's often the stuff beyond the calculator that really gets people, like completely forgetting that a toddler and a teenager need totally different approaches, or missing a critical safety check before you even think about administering the drug. It's all about seeing the whole picture, not just the numbers on a screen. And that's exactly why trying to just wing it on these questions is so incredibly stressful. You can't. You need a system. You need a mental checklist that you can fall back on when the pressure is on. So that's what we're going to look at right now, a little preview of the framework we've built at Exam Coaches to give you exactly that, structure and most importantly, confidence. Okay, here it is, our 4 pillars of pediatric medication safety. Think of it like a roadmap for every single peds med question you'll ever face. You start with the basics. Step 1, verify and convert. Get the order right, get your units right, no mistakes there. Then, step 2, you move to the actual calculation and you do it with precision. But, and this is key, once you have your number, you pause. You move to step 3, adapt. You ask yourself, how old is this child? What else do I need to consider? And finally, step 4, you prioritize all your safety checks and you document everything. See? It's a system that just takes all the guesswork out of the equation. All right, let's put this framework into action, shall we? Imagine this. The NCLEX clock is ticking. Tick-tock, and this question pops up on your screen. An 18-kilogram child needs amoxicillin. Now, what's your first instinct? Probably to jump straight to the calculator, right? But with a framework like this, you know the very first step isn't even about the calculation. What the process does is break it all down into these nice, manageable steps. So before you even touch a calculator, you're confirming units. Is the weight in pounds or kilograms? Check. Is the dose unit correct? mg per kilogram per day? Check. It's like you're building a series of safety gates into your process. That way, by the time you actually calculate the final dose, you're 100% confident that it's right. But what happens when just using weight isn't enough? For some really high-risk medications, think chemotherapy, you're going to need to calculate the dose using body surface area, or BSA. Why? Well, for these super powerful drugs, BSA is just a much more accurate measure of a person's metabolic mass than their weight alone. This is a huge NCLEX topic, and it means you need a different tool in your toolbox. And this is that tool. It's called a Nomogram chart, and you absolutely need to get comfortable using one for the NCLEX. I know, it looks kind of complex, but it's actually a really simple tool once you get the hang of it. You just find the child's height over on the left, their weight on the right, and then you draw a straight line between them. Wherever that line crosses the middle scale, boom, that's your BSA. The real key here is just practice, so you can do it super fast and accurately when that clock is ticking. Okay, but remember this, the most perfectly calculated dose in the world is completely useless if you can't actually get the patient to take it. And this is where we shift gears. We move from the pure science of calculation to the real art of nursing. Because let me tell you, administering medication to a child, that is a skill all on its own. So just picture this clinical scenario. You've done all the math perfectly, double-checked it, you're feeling good, but your patient is a 3-year-old and they are absolutely 100% refusing to take their medicine. Now what? What do? This is where your knowledge of child development gets put to the ultimate test. And this is exactly why knowing your developmental milestones is so crucial. You can't reason with an infant, right? You just provide comfort, cuddling, rocking, pacifier. For toddlers, you've got to expect that resistance and have a favorite toy or some other distraction ready to go. With a school-age kid, you can use therapeutic play or just explain things simply to get them on board. And for adolescents, it's all about giving them choices, a sense of control, and letting them participate. The right approach is always the age-appropriate one. Okay, so let's put this all together. What's the real formula for success on these super challenging NCLEX questions? Here it is. This is the key takeaway. Nailing it on the NCLEX isn't just about being a math whiz, and it's not just about being great with kids. It's about being both at the exact same time. When you can seamlessly combine that accurate calculation with developmental safety, that's when you're showing true clinical judgment. They aren't separate skills. They're really just two sides of the very same coin. And you know what? That is our core philosophy at Exam Coaches. We're not here to just teach you how to pass a math test. We are here to help you build the kind of clinical judgment that's going to make you a safe, competent, and really confident nurse. Our whole goal is to make this type of critical thinking feel like second nature to you. So what you've seen today is really just a sneak peek, a little glimpse of our structured approach to one of the toughest topics on the entire NCLEX. If you're ready to move past just memorizing facts and you want to truly master the clinical judgment you need for pediatric medication safety, well, the complete framework is inside, waiting for you. Let's go build that confidence together.